the second meeting of the Global Coalition on Synthetic Drugs, Sub-Working Group 2.1. Beginning this month of November through February, we will be looking at specific initiatives available to us through the international organization partners, and we'll also be exploring new activities or policies that we can initiate. In January and February in particular, we will have the full menu of activities available for review, and we'll invite you to express your interest to the international organizations and partners managing the respective initiatives. Other administrative announcements. Please update your screen name so it lists your name, organization, and country so we have more consistency. The coalition website is almost ready for launch, and so we will be sharing that address with you in the coming days as well. Also, we want to thank you for your feedback regarding the number of calendar invites. We recognize that we've been sending many calendar invites to participants for meetings. So in the future, for the future meetings beginning in December onward, we will send one calendar invite for the entire block of the 4-hour meetings for sub-working groups 1.1 through 2.2, and a 3-hour block of meetings for 3.1 to 3.3. And we'll still send the invites for both the East and West meeting times, but we will be cutting down on emails then. Just please remember which is your session. If you're only interested in this session, remember that this is the third session of the 4-hour block of meetings. We're also seeking to increase coalition participation to include stakeholders from all target audiences of synthetic drug issues. For example, chemists, policymakers, justice representatives, etc. Please continue to share the coalition registration links with your colleagues so we can make sure all stakeholders have a seat at the table. Now I'm going to ask Sarah from INL to paste the agenda into the comments section so we all have that, into the chat section. And I'm going to turn it over to the co-chairs for today's meeting to call on presenters, share thoughts, and moderate the discussion. So over to Benoit Archambault and Charles Perry for their moderation. Thank you so much. Bye-bye.
Welcome. I'm Charles Perry. I'm the co-chair with Benoit, as Brian said, and it's good to see so many of you on the call. So what we're going to do is we're going to, in our opening remarks, talk a little bit about what we discussed in our last call, because probably not everybody was part of that call. And then we're going to move on to our first presentation. So let me just start by just saying a few words about what Angela May said last time. I think it's always good to be reminded. She's the Chief of Research and Trend Analysis Branch at UNODC in Vienna. And she gave a presentation which highlighted how data and information can be used to estimate the size of the synthetic drug problem, also to assess its harm and to monitor responses. And she gave some examples on how to use and triangulate different kinds of data to properly describe and predict the synthetic drug problem and to understand its impact. And her presentation also highlighted certain indicators which can be used for this purpose and explained the main data gaps, as well as the challenges and needs in relation to the implementation of drug information systems necessary to produce these data. And we're going to be talking a bit about having some examples of drug information systems shortly. Before I hand over to Benoit, I just look at a few of my notes here. I mean, just to reiterate, she talked about the importance of triangulation. We don't get great data from just one source. And we also need to know the context in which data is collected in order to understand, what it encompasses. And also just made the strong point that better data are needed to explain the complexities around what's going on in the synthetic drug area. And amalgamation of many data sources are needed, as was mentioned, gaps in the data, and we talked about some capacity constraints, particularly in the South. So I think Benoit is going to say a little bit more about the discussion that emerged from following her presentation.
Yeah, thanks, Charles. Yeah, we just after that presentation, we had a very good discussion with a lot of people around the table, the co-chair, the chair. I think some of the highlights, of course, the need to better coordinate at the national level, especially through sharing data across different systems, not just drug analysis, but criminal justice system, health, law enforcement. So to be able to bring all those players together, the importance of using different source of data to, like you just mentioned, Charles, to triangulate the different type of data. Technology was also mentioned. There's there's a big role for the technology, artificial intelligence, digitalization, central database. So that's something that we, as a group, we need to look for. We also had a very not deep but discussion about wastewater analysis. I think it's a talk of the town right now. So that was discussed in details as a cost-effective tool to monitor trends in drug consumption in specific location. So of course, best practices will be shared through that table going forward to know how can we implement that kind of monitoring in terms of the wastewater. We had a discussion about the need to improve a national capacity, and we had an example about the Tom Kits initiative that was mentioned, a very good example of improving forensic capacity in the field. So that's something that we will probably gotta learn a little bit more going forward. And we also we closed the discussion mentioning that in some region the funding is not always possible or not appropriate. So the need for more sustainable solution was highlighted for those the countries or area where the funding is sometimes an issue, and we also need to take this into consideration. So that was in a nutshell what we discussed around the table. It was like a 15-20 minutes discussion, so it's hard to highlight in just a few minutes, but that was in a nutshell what we discussed. So yeah, so I think we're ready, Charles, for the next topic.
Sure, thanks, Benoit. So yeah, we're going to be jumping straight in, as you can see from the agenda, into early warning systems, and we've got examples at the international level, then the country level with El Salvador, and then going to the regional and sub-regional level with a presentation from the European Monitoring Center. So I'm going to hand over next to Martin Raithelhuber. I hope I haven't destroyed your surname. And from UNODC, he's got a long description here of things he's involved in. International Coordinator, Global Synthetics Monitoring, Analyses, Reporting and Trends Program, and also involved with the Laboratory and Scientific Service Division for Policy Analysis and Public Affairs, based in the UNODC in Vienna. So Martin, thanks very much for agreeing to give us a presentation today. Thank you. Over to you.
Thank you very much, Charles and Benoit, for the introduction. Pleasure to be here with you. Yes, I'm going to speak about developing early warning systems at the national level. Why do we absolutely need that? And then switch over to the UNODC global early warning system, what that can bring for our national partners present here in this meeting. But before I'm starting, I want to recognize our collaboration. We're not the only ones doing early warning and supporting national early warning systems. I see a lot of colleagues and partners here in the audience from the Organization of American States, CICAD, and also from the EMCDDA. But let me start my presentation here as a teaser, maybe, to start with the topic on early warning. So why do we need early warning? I mean, we see a massive expansion of the drug markets worldwide, whether we are talking about cocaine, methamphetamine, heroin, or other drugs like ketamine even. We see also emerging of previously separate illicit synthetic drug markets in the Americas, Asia, Europe, linked by international organized criminal groups. And we see in particular large-scale clandestine laboratories producing particularly synthetic drugs, but also the precursors chemicals needed for their manufacture. So there's a lot happening, a lot of dynamics happening here. And I haven't even mentioned the new psychoactive substances. I'm sure we are all aware of. Over 1,250 of them have emerged in the last 10 years and are complicating the whole scenario. So this is where we are what we are facing in our work in different ways. So realities are changing. There are new psychoactive substances, synthetic drugs, there are traditional drugs. All these names are making no longer such a lot of sense, maybe in some cases, because the whole problematic comes together at the local level. And that's what we want to talk about today: national early warning, things happening at the local level, the changes you want to be aware of, and then inform your stakeholders about. Just some examples of what is happening out there in your countries. Maybe, for example, fentanyl and other synthetic opioids have emerged in many Western Hemisphere countries, replacing heroin to some extent. Even more complicated, xylazine, a toxic adulterant, is found in samples of heroin and fentanyl, complicating the health, negative health implications for users. In some instances, cocaine and methamphetamine has been laced with a highly toxic opioid like fentanyl, often unknown to users, etc., etc. So this is the situation you're facing. Let's say the whole complexity of this changing global market, changes particularly in the synthetic drugs, they're playing out at the national level, and these are the effects you're seeing at the national level, and you want to capture with an early warning system, because you want to capture them as soon as they happen, be aware of them, and then give advice on policy responses to your stakeholders. So what are the elements of a national early warning system? I try to break that down to a very, very simplified and generic level, because I hope we're going to hear much, much more from our national colleagues here in the room. The main elements I selected here, the three main ones, is to have a data flow, of course, representing the relevant indicators. For example, if there are new substances on the market, if the purity levels change, going up, going down, if there are toxic adulterants in drug samples, like xylazine was my example, if the forms of presentations are changing, imagine THC cannabis products are suddenly presented in the form of chocolate, in the form of gummy bears, etc., and that might be new to the market. You want to be aware of it and make others aware of it. But that could also include emergency room presentations, data on overdose events, etc. In a nutshell, when we talk about data for early warning, we're very often talking about forensic and toxicology data, because that data is produced regularly and can be made available to the early warning system at the national level. Now, once you have this data needs to be assessed, analyzed, what it actually means. Usually that is done by a multi-agency technical table or a kind of committee looking at all the information coming into the system and deciding what to do with it. Does it need action? If so, what would the action be? So we're coming to the third element here, is communication. Early warning means exactly that, communicating. That could be an alert, but I put it into inverted commas because not every information the system produces is an alert necessarily. It could be also an early warning message, making stakeholders aware of the recent development. And these stakeholders can be very diverse. This could be the health sector in the country. This could be services catering for drug users. It could be the law enforcement, other laboratories, even the judiciary. It could be drug policymakers. The idea is always that these alerts make people aware who can take action and minimize the risks associated with this new development. So in a nutshell, that's early warning at the national level. Simplified it, I admit, very, very much. For the sake of time, I would like to move over to my next topic, and that is what can the international early warning, like the global early warning system at UNODC, bring to you? What can we offer? And again, I'm trying to share my screen.
And we can see your screen.
Perfect. Good. This is the front page of the UNODC Early Warning Advisory. It offers a lot of information. A good starting point is usually the news side, what has happened most recently. But maybe I'll run you through an example. Let's say you are a country in the Western Hemisphere. Any country in the Western Hemisphere, you want to know generally what is happening with new psychoactive substances emerging in your region. You want to be alert, aware of what is happening. With our system, you can select your region. Here I selected South America. You can drill down to a specific effect group. I selected here hallucinogens and dissociatives, because you notice here that in the region, this group plays a bigger role than in other regions in terms of the number of new psychoactive substances belonging to that group. And you will also be aware from your epidemiological surveys that drugs like LSD, drugs like ketamine have a certain prominence in your drug market. Now you want to drill down further of which are the latest developments here. You may have been aware of some ketamine products, and you may want to know, are there also some new psychoactive substances related to ketamine? And indeed, again, selecting South America and selecting just 2022 and 2023, you notice that, yes, there is a ketamine derivative, which has emerged already in Brazil and in Chile, the 2-fluoro-deschloroketamine. Now, it's just 2 countries which have reported this substance so far. So you may wonder, like, how relevant is this information? Is it just these 2 countries? Have other countries seen this substance as well? And you're drilling down further in our system, looking at all the countries which have reported this substance, 2-fluoro-deschloroketamine, in the last 2 years. And you see a whole list of countries which have indeed reported that substance, from Australia over European countries down to the United States. So indeed, this substance has not only emerged in Chile and Brazil, it has emerged in practically all the continents. That is an important information here. So it's not a one-off thing. You can then look also if this substance maybe has been placed under international control already recently. There have been so many developments. Between 7 to 10 new psychoactive substances are placed under international control every year. Maybe it was one of them. So our system allows you to see that information here on the scheduled NPS. And again, I selected the hallucinogens and dissociatives just to restrict the information to that particular group of interest. And you see there has been a number of substances, some N-bomb compounds, indeed a ketamine derivative methoxetamine, but not the one substance we are looking at the moment, the 2-fluoro-desketamine. It has not been one of them. But looking at our news, you will find out that indeed the WHO, World Health Organization Expert Committee, has looked at this substance already. Here it is, 2-fluoro-deschloroketamine. So they're currently reviewing this substance for international control. So because they also thought it needs a closer look. If you click on this link here, the link of the substance, further information will open in the system on chemical details, scientific information related to the substance, information on how to analyze the substance into your laboratory so that you can include it into your routine work. Here are some examples. And you will also find information on what the expert committee on drug dependence from the World Health Organization has found so far about the substance. And there's a whole report there at the WHO, which, among others, explains how the substance has emerged on the market, which countries have already regulated it, And interestingly, it has also been found in China, here in chocolate samples, for example. So that may be something you have not been aware of. So now that was a very, very brief and very rapid run through information available at the UNODC early warning system, which is available at your fingertips and which you can benefit from for your own decision making, particularly if a substance and information, a development is relevant for your work or not. Now, let me try to stop sharing. Here we go. And this is the end of my presentation. Looking forward to your comments, questions. Thank you.
Thanks very much for that, Martin. I think we'll just take points of clarification now. That was very very interesting, and we'll rather have the three presentations in detail. But if there are any particular questions people want to have you clarify, we can take them, or else we will actually. I think it makes more sense to take them as a whole. We'll have a longer period of discussion later. I can't see if there are any hands, but if anyone can. I do see, yeah, there's a question that we can deal with quickly, is from Grant Baldwin from the CDC in the United States. How frequently is the dashboard updated, Martin?
The database behind it is updated almost daily, but in terms of the dashboard, it's about every month.
Great, thanks for that. So I think I'm going to hand over to Benoit. We'll go on to our next two speakers and then come back to you if you don't mind hanging around. Thanks, Martin.
Yeah, thanks, Charles. Our next speakers is from El Salvador. Ms. Helma Cecilia Domenia. I hope I do not destroy your name. So from the National Antidrug Commission in El Salvador. So Mike is yours.
Sí, muy buenas a todos.
Yes. Hello, everyone. Yes, you have pronounced it correctly. I'd like to share El Salvador experience in implementing the early warning system. I'd like to start by commenting that we have data, but we don't have enough information to say that we are in trouble. We started to work with the UN SMART program, and we identified these issues and made a diagnosis. We saw that we didn't have the diagnostic capabilities for identifying these synthetic drugs, and in 2019 we developed a country-wide strategy for strengthening chemical precursors identification, and we've been getting closer to our global goals, and we have been providing trainings to raise awareness of all stakeholders on this issue and recognizing the psychoactive and synthetic drugs, and we have provided online or virtual trainings where we had massive engagement of all stakeholders, and also the United Nations have been assisting us, UNODC, with our trainings for identifying synthetic drugs, and we've been strengthening the law enforcement capabilities in the field, and we're also strengthening the capabilities of our forensic labs, of the national police labs, and based on this context we already developed the capabilities to identify these substances. And I'm going now to share this presentation. These are the data that we had on emerging drugs in the El Salvador early warning system, as established since 2014 to identify synthetic drugs for both men and women, and the type of substances that we had identified as being drug users of these synthetic drugs. On the other hand, we also had data about seizures at a national level of the legacy drugs, marijuana and cocaine, and also methamphetamines.
Bueno, sí, es lo que ella decía de que nosotros disponíamos de
Yes, so as I was saying, we have information, basic statistics, surveys on the use of any synthetic drug. And on the topic of seizures, what we usually do, we usually had more seizures of marijuana and cocaine, but since 2019, we've seen a large rise in methamphetamine seizures and ecstasy. Seizures have changed in terms of its use. And from that data, we were able to see that part of the drugs was being sold in clubs and the streets. So those were key elements, and the government organizations involved with methamphetamines and other substances allowed us to be able to implement this early warning system. So we implemented this early alert system. We established a mechanism for early warnings, taking into account the Coppola manual. So we based our decisions on that manual, but we saw that it was too broad, so we decided to see what we had in our country that we could work with. We didn't want to not do anything about it because we realized that if we tried to do everything, we weren't going to get anything done. So we checked what we had available within our country and what was possible within our country. So we did a fast assessment of risks, of sending out the warnings and disseminating the warnings. This, along with United Nations, Martin helped us a lot on that, and our experience has been shared and replicated in Guatemala, Dominican Republic, because they're in the process of implementing their early warning system. So we started with the basic terms, but this wasn't working, so we worked together with different agencies, coordinated by the commission, the Antidrug National Commission, and the National Drug Control Agency participated. They're in charge of reviewing the international norms, the Ministry of Health, and the agency in charge of applying the law, and the national police, and also with the labs that they can communicate with the labs to see what detection have been made. And there are also agencies that work with the legal aspect of it to analyze the deaths, and they participate because that information is useful for them for the criminal side of this. And we've worked with these early warning systems. We've been able to identify substances such as methamphetamine with a mix of cocaine and other caffeine and another substance. Then cannabidol and THC have been detected usually in vapors that are used for electronic cigarettes, and also paper that was used as LSD and that had 2CB and 25B and BOME, and in this case they were used as ecstasies for domestic use. These are new psychoactive substances that we identified in the country and were seized by the police. Also methamphetamine, crystal, blue and white. And we also detected these pink powder that was sold as TUCI, and they contained ketamine and methamphetamines, and they were attractive to minors. So this last one was this seizure in August, 449 ampoules that had were labeled as fentanyl, and they contained fentanyl, but they were labeled as 0.1 milligrams. So through all of this information, we were able to issue early alerts through this multidisciplinary and interagency group. We were able to evaluate the need, and it was approved to send out a public warning to warn the population that these types of substances were being used. Last year, we issued 4 warnings. This year, 2 warnings. The last one was for fentanyl, subproducts, and similar substances. So what we want to convey is that you don't have to have everything to be able to implement the system, because we also have in our country personal protection equipment for those working in the field to protect themselves from these illegally made substances. This year, we've seen reports from the National Drug Agency that in hospitals, the substances are being used for illicit purposes. There are cases in which some private clinics are treating people for addiction to fentanyl, and that is concerning to us because it's a way to generate demand to introduce illegal fentanyl. So we're getting ahead of them, ahead of those situations that we foresee. And we're also strengthening capacities and making the authorities aware, bringing awareness, and having them screen people who may come to the hospital. We hope that we don't have an epidemic on it. We hope not, but we want to be ready if it's necessary to be able to face it and help the population and our authorities. So this has been the experience of El Salvador. And if you have any questions, we'd be glad to answer them, but this is a summary that I wanted to share with you. Thank you very much.
Thanks a lot, Alma Cecilia. Actually, right now we're a little bit behind schedule, so we're gonna jump right away with the next presenters, and we may come back at the end with questions for both Martin, Alma, and the next presenter. So we'll mix all the questions together or clarification. So our next speaker is from the European Monitoring Center for Drugs and Drug Addiction, so the EMCDDA. So it's Joanna de Morais. And again, hopefully I pronounce it well. So the EMCDDA started its work on early warning in 1997. It is part of an interagency and multidisciplinary network that includes the EMCDDA and 29 national early warning systems. We are very pleased to have Joanna de Morais speak on this topic today. We know that this experience is very valuable and can hopefully benefit other national early warning systems around the world that are looking to strengthen or expand their activities. So without further ado, I would like to introduce our speaker today, Joanna de Morais, scientific analyst on new psychoactive substance at the EMCDDA.
Many thanks, Benoit, for the kind introduction and for the opportunity to present today. Good morning, good afternoon, everyone, wherever you are. I will be presenting on behalf of the Early Warning System team. Let me share my slides. Let me know if you can see them in the...
We can see the slides. Go ahead, please.
Thank you so much. So last year, the EU Early Warning System on new psychoactive substances celebrated its 25th anniversary. It was the first regional early warning system to be established to monitor NPS, and soon it has been recognized as a model for national, regional, and international early warning systems. The EU early warning system was established in 1997 after concerns that the emergence of ecstasy had revealed a lack of capacity in Europe to identify and respond to the appearance of uncontrolled substances that could be used for their psychoactive properties and cause harm. This led to the introduction of the first piece of EU legislation known as the Joint Action on New Synthetic Drugs that you can see in this slide. And of course, a lot has happened since then. The market has undergone periods of significant growth and change. And in response to these developments, EU legislation has been strengthened twice over the last 25 years with the intention of providing a stronger and faster response to NPS. EU early warning system is currently operating under the legislation from November 2017. And EU legislation defines a three-step framework of early warning, risk assessment, and control measures, which allows the European Union to rapidly detect, assess, and respond to the public health and social threats caused by NPS. The EMCDDA is responsible for the first steps in this system, which are operating the EU early warning system and conducting risk assessment. The European Commission is responsible for the last step for proposing control measures. The EU early warning system is composed of a multi-agency and multidisciplinary network, which includes, of course, the EMCDDA, 29 national early warning systems, Europol, the European Medicines Agency, the European Commission. The early warning system cooperates with a number of partners, including, among others, WHO, UNODC, EMCB, as well as forensic and toxicology networks such as TF and the APCCT. At the core of the early warning system are national early warning systems, which differ across Europe, as of course situation is different in every country. The organization and functioning of the national early warning systems are a national responsibility. However, experience shows that in order to function effectively, national early warning systems require a multi-sectoral, multi-agency, and multidisciplinary approach, and regular collaboration with national partners, including, among others, forensic science and toxicology laboratories, law enforcement agencies, poison centers, healthcare providers, drug checking services. The development of standards and best practices, such as operating guidelines and standardized data collection tools, are really important for the functioning of the early warning system. And after the new legislation came into force, updated early warning system guidelines were developed, and you can access them through the QR code in this slide. These guidelines serve to provide a common understanding for the operation of the early warning system by detailing the rationale, steps, procedures, roles, and responsibilities. The EMCDDA has developed a common terminology and definitions, as well as a set of common reporting tools in order to harmonize data collection across the network. In addition to the updated guidelines, a redesigned database on new drugs, EDND, was launched in 2019, providing the EU with a next generation information system capable of electronic data management. In this slide, I would like to briefly present an information flow in the early warning system. When an NPS is identified for the first time in a member state, a formal notification is issued to the network by the EMCDDA on behalf of the member state that reported the substance, and it is known as the first identification in Europe. The NPS is then monitored by the EMCDDA for signals that suggest it might pose health or social risks. For this, the EMCDDA uses information reported by the member states through the early warning system and other relevant sources, such as open source information. Following analysis of a signal by the EMCDDA, response actions might include intensive monitoring of the NPS, risk communications, and the production of an initial report, which might lead to a risk assessment. Similarly to early warning system guidelines, updated risk assessment guidelines have also been developed. by the EMCDDA to operationalize the technical aspects of the risk assessment. The guidelines are supported by a set of guidance notes. And again, these are available on our website through the QR code. So far, 37 NPS have been risk assessed by the EMCDDA. And it is important to note that this work is not only relevant for Europe. EU early warning system supports and contributes to the work of the WHO and the UNODC by feeding information into the UN system. And now, very briefly, regarding the current situation with NPS in Europe. Currently, the NPS market is characterized by complexity and increased integration with the market for established controlled drugs. As of today, through the EU early warning system, we are monitoring around 950 NPS. And so far this year, 22 new NPS have been detected on the EU market, which constitutes a preliminary drop compared to previous years. However, at the same time, last year, a record quantity of 30 tons of NPS was seized. And this was driven by a small number of large-scale seizures of caffeinols. Over the last year, we have also seen an increase in harms linked to nitazen opioids, emergence of trunk and benzodope in Europe, and outbreaks linked to the opioid market. To conclude, in this slide, you can see some of the lessons learned over the past 25 years. Reliable and timely information is critical for an effective public health response. And local, national, regional, and international early warning systems have all played a valuable role in providing information for action. Early warning systems need to continuously adapt to the ever-changing drug markets to ensure that they are fit for purpose. Co-production as well as engagement between partners at local, national, and international level has also proved critically important. And finally, day-to-day work of the early warning system is only possible due to continued commitment and support from the EU early warning system network. I would like to take this opportunity to thank our correspondents, colleagues from national networks and experts. I know that some of you are here today in this meeting, so thank you so much. And for everyone, in case you would like to learn more about the EU early warning system, I encourage you to visit our website. Thank you very much for attention.